So today we're going to explore a range of global examples of good policy making at the city level, places where innovative policies supporting tangible positive outcomes have been designed and implemented. And the focus of the session today is on the policy process itself and the challenges and enablers that those working in city context have encountered in this. So we'll have three panelists who will each speak for 7 to 10 minutes. We'll have a short panel discussion and then time for questions from the audience. And any other insights, in fact, from the audience, if you have any sort of questions, do feel free to put examples and cases into the chat as well. So the three speakers will be joining us today, and I will allow to give slightly fuller introductions when they speak. Councillor Shaista Aziz, Cabinet Member for Inclusive Communities and Culture at Oxford City Council in the UK. Miguel Carrera de Brito, European and International Affairs Advisor in the Body for Economy and Innovation at Lisbon City Council. And Miran Gaztek, Head of the Department of Urban Planning.
So hi, I'm not sure what time zone people are on, but it's 9 minutes past 3 here in Oxford. So good afternoon to everybody, and thanks to Carla and the team for creating the conference and for inviting me as well. So as already explained, my name is Shaista Aziz. I'm the Cabinet Member for Inclusive Communities and Culture at Oxford City Council. I've been a councillor here in Oxford for about 4 years. I'm a councillor with the Labour Party, and I've been on the cabinet for 2 years. Oxford is a city that I feel very proud of. It's a city I was born and raised in. It's where my family live, where my nieces and nephews live. I went to school here. You know, my parents came here from Pakistan in the 40s and 50s, and they chose to make Oxford their home. It's a very beautiful city. It's a very diverse city as well. People don't often associate Oxford with cultural diversity and you know, communities of colour and other, you know, diverse communities, but it is one of the most multiracial communities in the whole of the UK, and we're proud of that as well. So just to give you a bit of context, so at the City Council, we have a budget of £932.9 million. That's the budget that's been that was set last year, and the city itself has a population of 162,000 people. The wider county, Oxfordshire, is governed by the county council. So the City Council is responsible for collecting bins, running council tax, you know, things like that, the leisure services, looking after community centres, and other big issues like that. So that's basically some of the main work that we do. I wanted to focus this presentation on the Thriving Community Strategy and just talk a bit about this in relation to the subject matter that we've been asked to focus on. So basically, we've been developing a thriving community strategy at a time when the UK is going through a cost of living crisis, which has come about on the back of the COVID pandemic, which of course still is not over. And it's also coming on the back of more than a decade of austerity, which has had a really big impact on our public services and also on communities themselves. And I'm sure many of you know that right now there's a huge number of public sector workers who are also striking as well. And then obviously I'm going to mention the dreaded B word, Brexit. You know, there's a lot that's been going on nationally across the country over the last few years, and obviously that's impacting communities across the country, including here in Oxford. Excuse me. So what we're trying to do with our Thriving Community Strategy is focus on these key areas. So looking at children and young people, looking at culture, looking at community centres, and looking at leisure as well. And in our approach to creating this strategy, so initially, as I said, similar to my very brief introduction, we've been looking at the kind of issues that are impacting the globe. So the cost of living crisis, the environmental crisis. We've been looking at social justice issues that have galvanized the world, such as Black Lives Matter and other big prominent issues. We've also been focusing on the number of refugees that's increased around the world, and that obviously is impacting the entire world, including Europe and the UK and Oxford as well. What we've been doing is we wanted to learn some of the lessons that COVID has enabled us to learn, and that is about the need to have a closer relationship with the people of the city, and to make sure that we are more accessible to people. So during the COVID pandemic, we were one of the first local authorities to create hubs where we were able to do remote working, and then when restrictions were eased, we were working from our community centres, and ensuring our core team of people were available in the community centres to be able to assist communities at close proximity. And what we wanted to do with this Thriving Community strategy is to continue ensuring that that is how we work. So you know, the equality, we've been looking at equality impact assessments. We've ensured that they're embedded at the start of policy development work. Often in the past, what's happened, excuse me while I switch my phone off, what's happened is that they've been tagged on at the end of policy planning, but we understand that that's back to front. That's not how we wish to work. We need to put the equalities impact assessments front and center of our work. And, you know, as I said, COVID in particular has shown more than ever the glaring inequalities in the UK. I mean, they've been there for a long, long time, but they've become more and more entrenched. Carla, if I could ask you to go to this second slide, please. So, excuse me. And by the way, everybody, my coughing is because I actually have long COVID. So apologies if my coughing kicks in even more than I want it to this afternoon. So we started a city conversation. We called it a city conversation based on, as it says here on the slide, looking at different demographic groups across our city, drilling down deeper in terms of, you know, how they engage with the council. If they engage with the council, what is their perception and views about the council? We also created a cross-party group which was involved in developing those discussions and organizing those discussions. So we went out into our community centres, as I said, so dotted around the city. We made sure there was a good geographical spread, and we organised these discussions face to face, because we know that not everybody wants to hold conversations online. Some people do not feel comfortable with technology. Others want to have a more personal approach. So we've organised these discussions in many different ways. We have a business intelligence unit that helped us identify key themes. So basically their role is to help us analyze data and to you know, enable us to look at what's missing in terms of the data that we need to develop policy better. And they very much work very, very closely with us. You can see from the slide some of the areas that we've been focusing on. So we've been really focused on issues around green spaces, in particular because of COVID. We understand that, you know, people more than ever are also more aware, shall we say, of their need to be able to access green spaces in their neighbourhoods as well. So is it okay if we go to slide 3? Okay, so the idea behind the city conversation was to create an inclusive approach. So we needed to have safe spaces for discussion. So what I mean by that is if there were groups with protected characteristics who felt that they wanted to have a conversation with other people with protected characteristics, an example being the LGBTQI community, for example. There are other communities as well, asylum-seeking communities, for example. We organise those discussions in a space that they felt comfortable in, making sure that, you know, the environment was right for them. The slide sort of explains what the purpose of the city conversation was, just to really get a better understanding of what the shared vision is and what the desire is in terms of creating thriving communities in our city. This open and honest dialogue is really essential. So for too long, some people in some communities have felt that the council's been talking at them and not listening to people and not working with and alongside. And this is one of the biggest changes in our approach to this work and why we created this thriving community strategy. The change in approach is about not doing things to people or to communities, and not even doing things for people and communities, doing things with people and communities. So listening and understanding what the needs are, understanding what our duty is, legal duties are as a city council, and making sure that we connect the two together, and also understanding that people in the communities that they're from are the best placed in terms of understanding how services need to be delivered and how things need to be done. Now, obviously, it's not their job to deliver those services, but they want to be involved in developing them and shaping them. So I can't remember what slide we're on, but if we could go to the next one. So, the challenges are huge, okay? One of them, there's many challenges, as I said, in the UK. One of them is around budget constraints. So the local authorities have had their budget slashed and cut at a time when we need more money, because the challenges are huge. So we're very aware that we don't have more money that we can put into communities. We certainly are lobbying to make sure money isn't cut from communities. So this strategy really is about shifting our approach. As I said, it's about really understanding how we ensure that tackling inequalities is at the heart of the work that we're doing, and that we change our approach so that we have closer proximity to the communities that we are here to serve. Now, I think many people in City Council will be very open to admitting that there has been historically a bit of a divide between this whole divide between us and them. People often see those in power and in authority as being separate to them and not understanding their realities. And I think that's the case around the world. It's not just unique to a local authority such as the City Council. But I am very pleased to say that there's been a lot of work going on around us understanding the cultures in the City Council that need to be changed. And I mentioned earlier on the Black Lives Matter movement, for example. So one of the things that we've been doing around our equalities work, which does go to the heart of thriving communities as well, is we are one of the first local authorities that's implemented the race pay gap, which is not actually a legal requirement in the UK. The gender pay gap is, but the race pay gap isn't. But we've decided, rightly so, that we should report on it. And we've been looking at our internal workings and how we can make the internal workings more transparent, more open, and more representative, so that we have a more representative workforce as well. Now, the internal workings of the City Council and what we do externally and how we deliver for the people, I do believe goes hand in hand, really. If we are trying to be more equitable in how we share the resources that we have, how we deliver the resources that we have to also be able to show that we are creating a workforce that is more representative of the city as well. So there's lots and lots of challenges, but I also think, and I'm not trying to just put a positive spin on this because it's a very difficult time for people, in terms of people not feeling that they can afford, they have to make some, false choices between heating their homes and feeding their children. This is a very, very difficult and challenging time. And at the same time, it's also, it poses opportunities for people to help shape this work that we're doing with our communities team in a way that hasn't happened before. So one quick example before I wrap up, because I know I'm coming towards the end of my time limit. So just before Christmas, I was invited to Blackbird Leys, which is an area in the sort of around the Eastern Ring Road of the city. It's a very diverse part of the city. There's a big young population, a very working class area predominantly, and our communities team had organised a session for health workers to come in, and primarily the session was geared towards women from minoritized communities, and to talk with women and have a discussion and a conversation around health inequalities and how does that impact day to day. And one of the things that we were able to do there was really focus on the issue of long COVID. I'm very proud to say that I was heavily involved in organising this, because disproportionately people in community, working class, I should say, people and communities of colour have been hit hard by COVID in the UK, and disproportionately they are not able to seek help in the same way. So one of the messages we wanted to get out in this space was that help is available, and actually in Oxford we're very fortunate because we do have long COVID clinics that don't exist in other parts of the country. So what we were able to do was bring a whole constituency of people who aren't always necessarily listened to, and whose realities are not really positioned in terms of policy work. And I think it's important to hear from people directly as well, not just have so-called case studies. So we had a huge room full of women who were really, really engaged. And on the back of it, this week I had a meeting with health professionals who told me that there was a number of referrals that came through this pathway to the long COVID clinic, which wouldn't have happened if this meeting hadn't taken place. And so it's the reason why I'm sort of using this as an example is to show how you can work with stakeholders across the city in a way that brings them closer to the people as well, and enables them to actually understand the realities in the communities that often they're talking about without actually having any contact with. And I'll wrap up there, because really this is what the Thriving Communities strategy is about. We acknowledge that for many communities and people, they are struggling right now to survive. That is not an exaggeration. I'm a former international aid worker of 15 years, and I've worked in countries where there's very little infrastructure, and I know, what that means. And the levels of poverty and deprivation across the UK have increased very sadly. So it's really important that we, when we're designing policy, that we look around the rooms and we look around the tables where these policies are being designed. And if the people that we allegedly are designing the policies for are not present, their voices are not there, their realities are not there beyond, a curiosity of a case study, then I would say that, we need to work harder. And we also need to trust people and communities more. We need to understand that they may not have the resources, but that doesn't mean they don't know what they're doing, and they haven't been doing this work with no resources or little resources for most of their lives. So I think it's a really question of building trust, and trust is earned, as we know, but by shifting the way we speak about people and communities, and by respectfully engaging and making sure that our engagement isn't extractive. So we don't just go into communities to get the things we need from people, but we are physically present there when we're not looking for something from people, and we're making sure that we're being transparent in what we're doing, and we are making adjustments to our work through that as well. So I will stop there. Thanks very much.
Thank you very much. No, thank you very much for the contribution. And yeah, I'm keen to. I'm not keen to move on. I'm keen to reflect much more on this. I realise we do have to bring in Miguel from the panel, but if there are immediate questions of clarification for Shaista, please put them in the chat. But there is time for discussion and questions at the end as well. So please, yes, do keep any questions coming. But Miguel, if it's possible to hand over to you for your intervention, I will stop sharing.
Thank you so much, Carla, and good afternoon to everybody. It's a pleasure to be here, and I want to thank you for this opportunity and kind invitation. And I will try to be quick and to put a quick showcase of our Lisbon experience. And afterwards, of course, I think it could be very interesting to react and to talk about any detailed specifics about this conversation about good policy making with our experience, and we can bring all to the table. So I'll try to share some slides just to help the conversation. It's common sense that we have these flat lines of top-down approach or bottom-up approach, and we are all asking and we are all pursuing ways to create interaction between these different approaches or perspectives, and that's one of my focus today. So I was thinking about how these new approaches could mingle in these different more rigid approach. And first I was kind of seeing, I'm an architect, so I have kind of a visual way of thinking. I was kind of seeing a wave system that creates approaches and moments in time where you are more in a top-down approach and reaching for a bottom-up, and then you reach a kind of a bottom-up initiative, but the top it's a gravity, so it's pulling the waves with different frequencies and in time with within the urban context. But I was not completely okay with this wave kind of image in our experience, and I was trying to reach a more 3D, a more dynamic approach about our perspective and our experience. So I kind of looked for the DNA helicoidal helix to try to better understand the interactions over time that we kind of experience in our perspective, and I think they can occur differently, but in other geographies, in other contexts. So reaching this kind of new thinking diagram for the approach, I was kind of trying to reach here an idea that things are mingled, are completely interconnected. So in our case, and to make a briefly showcase of more than 10 years of work, it kind of started with a thing that was interesting, because it was a citizens group that were elected to the municipality in 2007, and they kind of worked. They enter the municipalities and the public service, and they bring along a new empathic form of working. They embedded new thinking, and they started. The thematic was surrounding housing, but in a more habitat kind of mindset. So it's not only the physical house, but living in the city, the housing as a kind of a pinpoint for your interaction with the community and with the urban context. So they started a big diagnosis within the municipality, try to identify all the layers in terms of social, urban, environmental, and economical initiatives. And they created a big, almost encyclopedic information about the city, and then they mapped with layers social, economical index, urban index, and environmental index that created a social territorial index for the city. And the interesting thing, this was kind of mathematical, scientifical, so kind of rigid and cold information. And cities and communities are everything but that. But that was kind of so important to create a baseline diagnosis, and then over that to open that information regarding the quest for vulnerable communities and territorial areas where that communities are. they open completely that information and the new proposals to tag along the issues to civil society. They open a big participatory approach for non-profits with NGOs, universities, different discussion models, direct models, round tables, big surveys, and it was very interesting, and it was kind of mind-blowing because it had more participation that the master plan survey that occurred more or less in the same time. So cities and communities were more engaged to this mindset, and with open mind questions and open to participation as a model to co-construct the ideas and then the programs to respond. And that new proposal with this cooperation model that was kind of interlinked between the municipality and the communities, kind of generates new ideas that kickstarted a very small new project for the city that was kind of targeting these communities, opening a cooperation investment proposal, and to open a program for local community development projects. And that was kind of built between a different approach of the municipality, trusting the local communities and the cooperation to respond with responsibility. So there is a trust and a responsibility, and to give to the communities all the significant aspects of the thinking, designing, and delivering a community project that is meaningful, that is important, is relevant, and it's had a kind of a big idea that is community cooperation between organizations, between community leaders, between universities. So you have to create a network, a small community network, to be able to be in this program and to make this project. You make your application. You had a jury with the municipality people, but also people, experts outside of municipality, and a selection program. And then, it was very quick, and you have more or less 50,000 euros investment for each project, 20 or 30 projects, and then you deliver that responsibility to these community networks to go and execute, to make these things happen. So action, this investment is based on trust and in the responsibility of delivering and in the action. This kind of make a return on a circle of learning with these projects that were small projects, more or less 12 months. So it was very quick, very fast, and it delivers things, real things, quickly, because we know that normally the public policies and investments and process are long between what you say and the time it's a delay to deliver, that normally it's completely stressful and creates a distrust on that. So this program was kind of a quick revolve, money and some resources to local projects in the local network to deliver a project that could be physical, immaterial, from urban gardening to public space to social inclusion projects, cultural projects. There was no kind of boundaries on the thematics, and projects could have all these kind of thematics mixed in a kind of a delivery system. So this kind of change everything, changes completely the game at local level, because it was kind of, and we have more than 10 interactions of the program, more than 300 local projects delivered, and it changes the community look for the municipality as a new process, a new way to operate, and also it changes internally the municipal organization that was kind of forced to respond in a more horizontal way, because you cannot respond by vertical silos to a project that is completely mixed with cultural, social, urban, environmental issues. So this kind of created new things. And one example was the local development department that was created in 2015 after some of these interactions. That was a new organization inside of the municipality that has that kind of new DNA system to focus on this kind of public policy. But moving along, this created also a communication link, okay, between communities, between projects in different neighborhoods. They were interlinking with each other, with our help, and creating also new networks within the municipality, from international European networks about this new process to city associations and networks for local development as an overall ecosystem. New organizations were created to emerge and appear, inhabitants associations, young kids associations, and so on. So this networking and this communication link and the network reinforcing of the in the ecosystem of the city was kind of mind-blowing, and the most important thing about it. And this kind of created a co-governance framework. So public and civil society were kind of like in this DNA attached, interlinked on this process, and also on new tools like co-governance office to a given neighborhood, where you have a deputy mayor, you have inhabitants, presidents, associations there, you have universities, all in the same table, piloting, navigating issues and decisions about a given community, a given neighborhood, but also new kind of information, big links about what is happening in every aspects of the city. And this created, and I'm not going to be detailed about it, we don't have the time, but it created, of course, local development on the communities, on the city itself, new ways of doing things, new stakeholders, but also, and I think this is the interesting point here, at this point, almost 10 years from the kicking starting of this, the strategy. So it was kind of the reverse system of what is normally that's normally done. The strategy was not the first thing. So, and I'm not saying that's good or bad. I'm just saying, and it was kind of an action policy that was ongoing, transformation, getting momentum, and it worked, because if it hadn't worked, it was not a big deal. It was not a big strategy, a big document, a big thing that was going to the can. But the strategy itself was almost co-created along within this ecosystem with the different forces, from the politician to the technician on the municipality, the departments, the NGOs, the economical fabric, and the common citizen. And this is not a perfect experience. Okay, there are none, and this is not a perfect experience, but the public policy was kind of a result of the process, and the strategy was kind of on the end of the process. And that's what I think is interesting when we embed this with a kind of a participatory approach, a co-governance idea for the city, an open idea, an open source idea. So the thing that is most important about this is the synapse, the new synapse that were created in the city, inside the municipality, inside the communities, in other mainstream organizations. And this is so important. And I go to COVID here to finalize my presentation, my talk, is that the COVID pandemic moment kind of triggered these synapse, and the municipality and the community were kind of at the same time interacting and creating quick responses to this emergency situation, not only the health situation with some projects and initiatives to help our health system, but also kind of helping those that were behind in social terms, and that were kind of crushed with the pandemic social and economical I don't know, crash. So and we have a number of examples, but just to say that this was so important, and the investment, the money, the resources with this network were able to go so quickly, so efficiently, so capillary to the community where the problems are, without not the many layers, not many barriers. And that's, I think it's the most important thing about this process that I want to highlight to policy making thinking. And the most important thing about our experience, and I think all the policy making, it's the energy. Okay, it's people. It's not data. It's not money. It's not other resources. It's not property. It's people, energy. People bring energy to the table inside the municipality, inside the organizations, politicians, citizens, technicians, young people, children. Everybody is on. If he's on board on one given moment to a given idea, to project, it's going to happen one way or the other. It's going to happen, and that energy, it's kind of a potential, immense potential for urban context and to new policy making. And I think wrap up here. Thank you so much again, and I'm completely open to any question, remark, anything. So thank you so much once again.
Excellent. Thank you very much, Miguel. And yes, thank you. And any questions, any thoughts, any comments, please, everybody continue to put these in the chat. We have about 10 minutes left of the scheduled session. I will apologize. It may be apparent anyway, but I will apologize on behalf of our intended panelist, Miran, who has not been able to reconnect. Unfortunately, there was rather a significant technical issue, but we will be sure to follow up. And of course, if there's anything that he wishes to share when we distribute the notes and the sort of wrap up from this session, we'll make sure that that goes out to everybody who was in attendance, but apologies on his behalf for that. But yes, please, any questions, any thoughts, any comments? It's wonderful actually to hear two very different, but in many ways like very complementary perspectives that you've brought in. And I think in terms of these sort of key enablers and the energy, the people, the relationships, I'm curious, I think in both cases, and I think both of you alluded to this a bit, but there was the space, there was the time, and there were the resources to be able to build these great engagements. Is there a bit of a longer history to that in both cases? Like, were there really critical things that happened maybe just before the projects that you're describing that helped precipitate them, or things that happened sort of within that period that were real, sort of turning points towards these successful outcomes, if that makes sense? Like, what was the groundwork and what were those key points that enabled this?
Yeah, so I really liked Miguel's presentation. Thank you for that. And I do think there was a lot of similarities between what you had described in your city and Oxford as well. Without a shadow of a doubt, I do believe COVID, it was a key factor in changing the way we as a city council have been developing engagement with communities. Like I said, it's not gone away, it's still there, right? The economic fallout, obviously, first and foremost, you know, the number of people lost their lives, number of people who are unwell, got long COVID. Let's not forget, I'm in the city that's developed the vaccination as well. You know, so it was an opportunity. Well, it wasn't an opportunity, let me rephrase what I'm saying. It was a moment which really needed to create a reset in the way we were thinking about inequalities and how we tackle them, and how we engage better with communities on their terms, not on the city council's terms. So I definitely think that was one of the key factors in it. It was, you know, it caused a big shock, should we say, not only to the city and the country and the world, but also to a lot of systems that kind of maybe thought that the system was working okay or fine. It didn't really need much readjusting, and then something like that happens, and actually you have to go back to scratch and relearn a lot of things. So I definitely think that was one of them. But also I think, like I said, I've said it, referenced it a few times. I'll reference it again. The Black Lives Matter movement had a profound impact on our city in Oxford, because we are home to Oriel College, University of Oxford, where the statue of Cecil Rhodes is, and it became a key part of the story nationally in this country. And so for the first time, what you saw was 3,500 people from our city taking to the high street, sitting down in our historic high street, and you saw a convergence of Black Lives Matter, the people of the city, and the Rhodes Must Fall movement, which primarily is the University of Oxford. And often the University of Oxford and the people more than often don't mix. And so you saw this real like convergence of you know, the town and the gown, as we call it, and you're forced to really examine the power dynamics between both, and where the resources are held, and where the power is held, and where the money is held, and all that type of thing. So I would say that those were two very instrumental factors in the last few years that made the city council re-examine quite a bit of what we were doing in relation to communities and consultation.
If I can add some, in our case, I think the moment itself when the trigger was the economical crisis back in 2000, when we were 2009-10, and that was crucial for the mindset and to create a counter cycle mindset. So where the investment was shutting down in the city was without many resources and so on. This was not only financial investment, but was kind of saying now this is our priority, and shuffling names from the past that were kind of for some communities or neighborhoods that are with different names, like dangerous, like, we want to create priority neighborhoods where our communities that are more vulnerable to this economical crisis. They were vulnerable before this, so they are. And COVID was kind of a repeating cycle of that necessity, and also I would say that in some cases these communities, and I'm not saying that this is everywhere, but in these communities the cooperation, it's not a will, it sometimes is a necessity, because the resources are not completely there, so people have to rely more on each other than in other communities, and that was also a kind of a good baseline for a better understanding. And what this initiative bring and had to work with citizens, with people, was trust. People need to trust that things that were said and the people were working on that was not going to abandon on the first problem, and they were on the field with and there were faces and conversations, and that trust was kind of the building block for everything.